Salt, or sodium chloride, is an essential mineral that plays a vital role in many bodily functions, including the regulation of fluid balance, muscle function, and nerve function. However, consuming too much salt can have detrimental effects on the body, leading to a range of health problems. When we consume too much salt, our body retains excess water to dilute the salt concentration in the bloodstream. This can lead to an increase in blood pressure, as the extra water puts pressure on blood vessels, causing them to narrow and making it harder for blood to flow through. High blood pressure, also known as hypertension, is a significant risk factor for heart disease, stroke, and kidney disease. One of the primary concerns with excessive salt intake is the effect it can have on blood pressure. When we consume too much salt, our body retains excess water to dilute the salt concentration in the bloodstream. This can lead to an increase in blood pressure, which can put a strain on the heart and blood vessels. Over time, this can cause damage to the arteries and increase the risk of heart disease and stroke. Consuming too much salt can also have a negative impact on the kidneys. The kidneys are responsible for filtering waste and excess fluids from the body, but when there is an excess of salt in the body, the kidneys have to work harder to eliminate it. Over time, this increased workload can lead to kidney damage and a decreased ability to filter waste from the body. In addition to these health risks, excessive salt intake can also contribute to weight gain. Consuming high levels of salt can lead to an increase in fluid retention, causing bloating and swelling, which can make us feel heavier. Additionally, salty foods are often high in calories and can contribute to overeating and weight gain. It's important to note that not everyone is equally susceptible to the negative effects of salt. Some people are more sensitive to salt than others, and certain medical conditions, such as diabetes or kidney disease, can increase the risk of salt-related health problems. So how much salt is too much? The American Heart Association recommends that adults consume no more than 2,300 milligrams (mg) of sodium per day, which is about 1 teaspoon of salt. However, the ideal amount of salt varies depending on individual factors, such as age, sex, and overall health. Reducing salt intake can be challenging, as salt is a common ingredient in many processed and packaged foods. However, there are several steps that can be taken to reduce salt intake. Read food labels. Check the sodium content on food labels and choose products with lower sodium levels. Cook at home. When cooking at home, use herbs, spices, and other flavorings to enhance the taste of food, rather than relying on salt. Eat fresh foods. Fresh fruits and vegetables, lean meats, and whole grains are naturally low in sodium and can help reduce overall salt intake. Be mindful of restaurant meals. Many restaurant meals are high in sodium, so be sure to check nutrition information and choose lower sodium options when dining out. In conclusion, consuming too much salt can have detrimental effects on the body, including high blood pressure, kidney damage, and weight gain. Reducing salt intake can be challenging, but by making small changes to our diet and lifestyle, we can improve our overall health and reduce the risk of salt-related health problems. Thanks for watching.